Good morning. My name is Ann Brazeau. I'm the CEO and founder of MPN Advocacy and Education International. Thank you so much for joining us this morning to discuss a very important subject, caregiving and what it means to be a caregiver. And we have three panelists with us today. All three are caregivers and were caregivers and are caregivers. Denise, Sarah, and Sylvia will be joining us. And I'm going to briefly go through a little PowerPoint presentation, and then you will hear from our panelists. They will give their stories. And before we start, I would like to thank our industry partners. There are lots of them these days, so you should be happy to hear this if you're a caregiver to an MPN patient, because lots and lots of things are happening in the MPN world with new drug development. And you can see our partners are Insight, Pharmacentia, Sierra Oncology, Giron, Protagonist, goes on, CTI Biopharma, AbbVie, Constellation Pharmaceuticals, Bristol Myers Squibb, Acceleron, Imago Biosciences, and Cartos Therapeutics. All of these, and actually Giron, it should be up there. Sorry, it isn't. Oh, it is. I'm sorry. Our faces are covering it. So all of these partners make our work possible, and we thank them very much. I really appreciate it. And so moving right along, I'm going to present a PowerPoint presentation, just a brief one that we have done in the past when we host our in-person events. We often will do breakout sessions with our caregivers, and it's phenomenal how much is revealed to us. Basically, just to share a little bit of background, I have been a caregiver. Kathleen, who many of you know, has been a caregiver we were caregivers to our mothers. I was telling Denise before we started that we, as caregivers, don't realize that pretty much it's a full-time job away from our full-time jobs. I know that Sylvia works and Sarah works and at other jobs besides caring for their children who have MPNs. And so I'm looking forward to a lively discussion and being able to offer some resources and some pointers to help you be a better caregiver, but also to take good care of yourself. So the first slide is pretty, basic, but one of the bullets I left off was to listen. I remember very clearly with my mother, and I would go to the doctor appointments and bring my pad and paper, and I would jot down whatever I thought was important. But the fact of the matter was, I wasn't really listening to my mom as much as I should have. I was listening to the doctor talk to her. And writing all of the things he said, but I wasn't really listening to my mother when I was sometimes as I grew into the role as caregiver, I started recognizing that the physician, who was fantastic, her cancer doc, would sit with her and kind of tell me to sit off in a corner. And he would look directly in her eyes and hold her hands and say, "Tell me how you're feeling. Tell me how you are feeling. Tell me what issues you have." He was one of the good ones, I have to say. But we really have to listen to the person that we're giving care to, because we're their advocate basically, and we need to be able to share with a physician, with a social worker, with whomever it is that we deal with on a regular basis during their care, what we're hearing from them, any differences in how they feel, and so on. And we also need to be educated. My mother had cancer, but not blood cancer, and then ultimately passed away at age 95, God love her. But we need to be educated on not only the disease we're dealing with our loved one, but also be educated on the system, on the medical system. And I know Sarah and Denise can speak to this big time, but the insurance stuff, all the different things that encompass caring for our loved ones. It's big. It's a big job. And there are lots of moving parts. I mentioned taking notes at all appointments, not just the doctor appointments, but if you meet with a counselor or nurse educator or social worker, whatever the heck it is, make sure you're taking notes. And if you don't understand something, ask. We try to help when we get calls from patients saying, but what about this? We try to find the answer for them or direct them into the correct resource, but make sure you're asking questions and make sure you're letting the people know when you're with your person or even on your own that you are their advocate. You are part of the team. When there are meetings with other doctors, you get to go. You are there sitting at the table with them. And respect your loved one's abilities. I remember my mom would go, no, I don't need you to do that. Let me do that. And I finally realized that as she gained strength, she wanted to do things for herself. And she wanted to speak on her own behalf. She was still very with it mentally. So that was very useful. And those are things to try to remember. And then allow others to help. Boy, is that a big one. And Denise spoke about this when we had our stem cell transplant program. If somebody offers to do laundry, to go to the grocery store, to sit with your loved one for an hour, if the patient or the person that you are giving care to is well and a child and whatever can do their own thing, but you just need a break from it all. Take it. If someone's offering, go for it. If a family member says, take 2 days, I'll come and stay at the house and, you and your husband go on a weekend vacation, or if you can, or get away for a while. Do it if you can, because we all know caregiving is a full-time job. Many of us work, full-time as well. And it's important to take those opportunities. So it's okay, there's a big emotional side to caregiving, and we're allowing and we're saying, and everybody's saying, it's okay to be ambivalent. It's okay to have good days and bad days. I know we all are like we're hyper about it and hypersensitive to our loved one. What's happening with them today? How is it today? It's okay to feel both. You can, just like any other time through this pandemic is a great example. We have good days and bad days, and caregiving is, as I keep saying, is not an easy job. And so allow yourself to feel that. You may get angry, you're coping, you're trying to, get through some difficult times. When it's a child, you may be asking the question, why would this happen to my child? Why this is not fair. And so anger is an emotion we all have, and it's okay to feel that. And find constructive outlets. Forgive yourself first about feeling that way. It's okay, but find some constructive outlets, maybe yoga or going out with a girlfriend or friend to have a coffee or something, and having somebody that you can say, I am just not happy today and I'm angry about this. And having a good person, a sounding board that you can engage. There are social workers and people at hospitals and at cancer centers that are very good at this. They're very good at listening and giving you a shoulder, basically. And we're here too if you ever need us. There's a lot of anxiety around caring for a loved one. Am I going to keep my job? Am I going to be able to fulfill my job with this other huge job I have at home? But my family comes first and my loved ones come first. And how do I blend this? And how do I do this that allows me to keep my position and allows me to have a little bit of my own life? Anxiety is huge. And, there are some coping skills that you can learn. I know this is kind of a silly thing here, but you can, there are online, through this pandemic, I learned so many online programs. I found so many online programs, yoga, breathing, meditating, everything is there if you need it. I know it's not in person, but it's all there. And it may be swimming. It may be walking in the woods, which I do frequently. I love nature, and nature can really bring you back to center, I think. But I guess my biggest point is don't feel ashamed or embarrassed that you feel it. It's okay to be bored. Oh my God, I can't tell you the hours I spent sitting in my mother's living room. She was sound asleep, and I would check on her periodically to make sure she was still breathing. And otherwise, I would be sitting in the living room trying to read, trying to work, trying to do something. And sometimes it would be so boring and quiet. And, you know, you have to take a break and enjoy the rest, enjoy the time, and find things that you can do in those positions that allow you to keep your own self going. And sometimes as a caregiver, it gets pretty boring to just talk about it all the time. You know, when someone says, how's so-and-so? You think, oh my God, I've got to pull that out again and talk about this. And sometimes I would say to my friends, she's fine. I just really don't want to talk about it today. You know, there's a lot of sadness that can come with caregiving and depression. And we'll hear from the mothers that, you know, have the young children with an MPN. And we'll hear, I hope, from some of the viewers today. It is sad. It's a very sad thing to see a loved one going through some tough physical times. And we all know that some of our patients suffer from grave sadness and depression. And so, you know, it is treatable, doesn't always have to be treatable by a pill. But if you need it, if that occurs, that is completely between you and your physician and maybe psychologist if you have someone in, you know, helping you. I do know a young family with that they do see a psychologist on occasion, not often, but when they need to, when things change, they try to include that professional in their caregiving process. So it's okay to feel fear. Of course we feel fear. You know, we're coping and dealing with somebody that we love very much and that we don't know what the outcome of their life is going to be, or there's a change in their life and there's a change in their health and we don't know what that's going to be like. We may have grief. I have said this a million times. I think Kathleen has shared this also. I was grieving the loss of the mother I knew. Not before, she hadn't passed away yet, but I was grieving that woman that I could go pick up and have lunch with, go pick up and have, you know, go hear music with her, or just go sit and talk to her and have a normal conversation. When you have a loved one that's ill, you grieve the loss of that healthy person that you knew, and or you grieve the fact that your child or your partner is sick with something that, you know, can be pretty difficult sometimes, and so that can be difficult. So grieving is part of this. You may have some guilt, you know, like what could I have done? How could I have changed things? How, you know, what should I have done better? You know, it's all part of the process, and these are all you know, things that we all go through when caregiving. So we need to, as caregivers, apply the same thing to us and the same needs to us that we do to patients. And that is very simply, we need support. I would call on girlfriends, whoever I could talk to, sometimes a social worker. We need to make healthy choices for ourselves to stay strong and to be, you know, we have a lot of work and we have a lot of energy that's required of us to kind of eliminate what stressors we can eliminate in our lives. We need to rest when it's appropriate and take a break. If you can exercise, do it. I mean, even if you're with your loved one who maybe can't keep up with you sometimes, but take a walk, even if it's to the mailbox, just something to get outside or sit outside in nature. Keep friends and family close and take enjoyable breaks. I mean, sometimes just taking a drive. Last night I took a drive with a friend. We always feel this way. We'll have a night where we say, let's just go for a drive. We find really wonderful places to that we never discovered before, you know. So sometimes that can be a real nice release. And I found this the other day and I thought, or a while ago, and I thought, this is pretty interesting because honestly, it's true. In my case anyway, when I was caring for my mother, my memory skills were like this. Even though it was the first year of menopause, by the way, that she was really sick, I had fuzzy brain out here. But when I was with her and had to remember all the things that were going on with her, I just was on it. I just knew, I remembered. And so they say it does improve your memory skills. I was more physically fit because I was lifting her and caring for her, but I was also running around like crazy. And this is a scientific discovery that, who knows if it works for everybody, but they say that when you're a caregiver, there's a lower mortality rate among caregivers because we have to be on it all the time and be there and be present and be doing what we need to do. The rewards are vast, as we all know. It's time with the loved one. Your whole young life, you can't wait to get away from your parents. Well, toward the end, it's like I just wanted to be with her all the time. And not that we're all losing people, but when someone's going through a traumatic time and you need to be very much a part of where they are. I just told the girls earlier, the women earlier, my friend said to me one time, never wish time away. That no matter what's going on, do not wish the time away. Maybe the circumstance, but not the time. And it's very true. It improves relationships many times. When I was at hospice, we used to bring people together and families kind of reconnected sometimes. But when a person has something, a chronic illness in the family, or with friends, very often it brings people together. And it's an opportunity to make a difference and find personal and spiritual growth. So here are some resources for you besides us. There's a Caregiver Action Network, there's a Family Caregiver Alliance. AARP actually has some great resources, but also just connecting with other caregivers like we will today, I think is very important. And the conversation needs to be alive and well throughout the years that we take care of other people. And there are rewards and benefits to both. And so with that, I'm going to quiet down here and we're going to hear from Denise. And Denise is going to share her caregiving story and her story period. And if you have any questions, send those through and we will ask as we go along here. Denise?
All right, Anne, thank you so much. And I want to extend my thanks to the MPN Advocacy team for putting this webinar together. I think it's very important for caregivers going into this journey to know and get a sense of what's about to happen and how your life is going to change and what it looks like, and to make the utmost best out of it. And I can't thank you enough for your presentation to hit all those points that are so vitally important to caregiving and making it happen, and the things that you go through. As you said, many times people forget about the caregiver. It's all about the patient, but you have to stay healthy and centered and grounded to help continue that journey. So I want to just let you know that I was the caregiver to my wife, Andrea, who had myelofibrosis, and she had a transplant 3 years ago tomorrow. It's her anniversary date. And as a caregiver, I wore many hats. I was an information keeper. I was the protector, the guide, the cheerleader, the motivator, the supporter. It just continued. Everything that needed to happen, I was there to help make it happen. I used tools during our journey to help keep us organized and to keep up with everything that was going on. As Anne said, there's many moving parts. So one of the things that I created was a 3-ring notebook. In that notebook, it kept the medical records, blood tests, the health stats, any incidences that Andrea had, doctor questions and answers, which were great for reference at another time. And most importantly, or at least it was most important for me, was the spreadsheet that I created for medications. And I really stressed that from the standpoint of the one thing that I recognized, that there would be a lot of meds that she would take. And of course, they're going to be temporary, but there would be significant changes within those, whether they occurred from daily to weekly. the number of meds that she would take in addition to her own medication list. And then one other important part to that was knowing what the medication was and the dosing and the names and the frequency, because once you left the hospital, if you had to be readmitted again, whether that was at the facility or in another location, you had to know what medication was being administered. And you needed to have that on board with you, and be able to advise the hospital staff that you had a transplant patient and give them all the details. To help stay organized with the medications, I used my alarms on my smartphone, and I labeled those. And so that helped me keep track of the dosing. And let me tell you, those alarms were going off every hour, every couple of hours. It was constant, but it was a great way to help me keep track with what was happening. I kept the 3-ring notebook and the medication in a roller bag so that it went with us everywhere we needed to go, so that if there something popped up and we needed to get back to the hospital immediately, I had the information and the details with us. During our journey, of course, Andrea has a very large group of friends, and we needed to communicate with our family and friends. So we used Caring Bridge to help keep up. We kept up with daily posts, and then as things were quiet, every couple of days. But anyway, everybody enjoyed knowing what was going on. That was really important. And as Ann had said, knowing everything you can know about the transplant is so important. I recognized that Andrea had her own physical, mental, and emotional journey that she was going to be going through. She would be preoccupied with her recovery. She may not recall what was going on. So that meant everything else fell to me to make sure it would happen. And I said, well, what's this picture look like? So not having any information, I availed myself to the hospital resources of everything. I read everything I could about the transplant, so I would know what was happening. I figured that there were 4 phases involved, and those were more time sensitive. Pre-transplant was really about preparing her body in advance for what was about to happen. So that was pretty much taken care of. But again, know the process, know what's happening, know where you need to go. Of course, the transplant itself. Then the 3rd phase was discharge from the hospital, but you still had to remain close to the hospital. And then the last phase, or I call it the last phase, release to go home. So in the we'll just kind of skip through the pre-transplant phase, because the preparation in the hospital was all done by the hospital staff, and you were there, of course, just to observe and to keep track of everything that was happening. So I want to move into the 2nd phase of it, and this to me was kind of the most important phase because it set the stage for everything else that would transpire after the transplant. So one of the first things I did was that Andrea and I talked a lot about, am I going to lose my hair? We just said, you know what, the likelihood of you're going to lose your hair is going to happen. So let's just go shave your head. And I decided I'd shave mine too with her. So we kept that going. I also decided to stay in the hospital with her so that I could see firsthand how the transplant team would take care of her. And that was, again, very important for me in setting the stage so I would know how to deal with things. Our day would start with, the most important goal was to get her ready for the doctor visit. So we knew the time about that they would be there, but we needed to get her up, get her fed, get her showered, get her dressed. And you think, today when you do that, you think, oh, I did 15 minutes, 30 minutes. Well, when you've got a transplant person, everything is different. That whole process could take us 2 hours to get her to get her fed, to get her showered, to get her dressed, to get her ready. So we didn't want to be rushed, obviously, and we didn't want to miss the doctor's appointments either. So that was a journey and a whole new way of getting ready. In our doctor's appointments, we made a list of questions that every time we saw them. And so they would, of course, talk with Andrea during that process. And anything that she might have forgotten, I would fill in. And again, as Ann said, you're an advocate. And you're telling them, hey, what's going on? So we kept that. So we wanted to create a whole picture for of what was happening with Andrea, so the doctors had a real good idea of what was going on. And of course, they were in all the time. The transplant team, they're in taking vital signs 24/7. So it was about every 4 hours. At the minimum, you saw everybody, or at least saw one person, if not more frequently. When the transplant team came in to take care of her port and clean her bandage, I really paid attention so I could gain more knowledge and processes of how they handled it. Anytime the nurses came in, the medication administration, I wanted to know the name, the dosing, the frequency, what it was about, what it was taking care of, to help Andrea get out of the drone of somebody always coming in and saying, hey, we need this, we need this, we need this from you. We entertained her. Andrea's sister was with us for about 8 weeks or so into the transplant. And so she was read books aloud to Andrea. And that was really great because the important thing was for Andrea to not lay in bed all day long. And so getting up and sitting in the chair and listening to the books that were being read to her, going for walks, going for bingo, going for physical therapy. All of these things were an important part of her healing process, because one of the things that the team stressed was that movement is medicine. And let me tell you, she wasn't real keen on wanting to move, because everybody responds different. That's one thing you need to keep in mind. But in her case, it was important that we had to really encourage her to get up and keep going and make movement. And you could really see the process of her healing occurred. And that was really exciting to me. And of course of her as well. So in the third phase, which was now the scary phase, this was the discharge from the hospital. This is your first getting out of the bubble. You take a step out, so to speak. So one of the priorities there was to keep Andrea's immune system protected while it was being in the process of being rebuilt. So we wanted to stay ahead of her. We needed to open the doors. We needed to be sure she had a mask on and hand sanitizer on hand all the time. And of course, now we all are very familiar with masks and hand sanitizers, but it was a new thing at that time. When we left the hospital, we were very close in proximity, because we knew we had to go back and for weekly appointments to visit the doctors. She had infusions, fluid infusions, whether that was blood or platelets or magnesium or whatever was necessary. She would have labs drawn before every visit so they could assess what was happening and then, of course, administer appropriately. It was my responsibility now to clean the port and to get her bandage changed. I not only had to administer her medication, I also had to refill her medication. And now I also had grocery shopping and cooking to attend to. So all of the stuff that was happening in the hospital, I wanted to have as a routine. That was my decision to stay in, so that when I got out, I knew I had to do this. And now I have all these other things I had to take care of too. So I didn't want to mess up the routine. The fourth phase, which was the out of the hospital phase, this was when you got to go home. This was the return to normalcy. This was, you get to leave the bubble, and it's exciting and it's scary, because you can't just run over to the hospital and say, oh, we have this happening. Now you had to call, or you had to be prepared. You had to, the burden of really, or the responsibility of really making sure you had our medications on board and knew what was happening was even more critical, because you were the person that needed to advise a new medical team of what was happening if there was any type of incident. Also, when you got home, it was very easy to slip into old habits. Familiarity brings familiarity. So you want to be careful. We needed to continue to protect her immune system. So again, we had the hand sanitizers, the masks, and just really protected her from the sun as well. I think some of the frequent phrases that I used during the whole transplant journey, and you'll of course come up with your own, are it's only temporary. It's time for your medication. It's time to clean your port. Let me get you something to eat. Would you drink some water, please? Let me get this for you. Oh, you are doing great. You can do this. You can do this. Hang in there. It's only temporary. And this is normal. This is typical. That's a big one that you could use. And in particular, no, you can't do that. So in closing, again, just to echo Anne's presentation and her insight, I think that it's very, very important for you to take care of yourself as the caregiver and do welcome those breaks. In fact, as you go into this, I would set up some people, some friends, if you have those close by, to help you take care of the groceries and to bring in food or to do laundry, even as Anne said, take a walk. It's just nice to have somebody else in there so you can get out with nature, take a breath and get some perspective, and then go back at it and recharged and ready to make things happen.
Thank you so much, Denise. And there are several questions actually. So you had a very specific situation because Andrea had a transplant, and that required so many different things, which you know, are so important and vital to her care. But how did you take care of yourself truly? Because you were really, that was a big job. And so how, you know, one of the questions is, what do I do when I become so overwhelmed, you know?
So the opportunity, I put some of that in place when I was in the hospital. I would take breaks, I would go outside, I would go to different floors. They had quiet floors because I knew at that point, Andrea could be left alone in the sense that she had the hospital staff to take care of her. And I knew that I needed to set up some habits and form some habits for myself where I could go and just breathe and meditate, listen to music, whatever I needed to do to just let it go, let all of the stress go and calm down and then recharge. And so I did take advantage of that while I was in the hospital. When we got out of the hospital, it was a little bit more difficult, but as I said, we had Andrea's sister with us. And so there's a time period out of the hospital that Andrea needed to have somebody with her all the time, 24/7. So I would volunteer, said, hey, Kathy, I want to go do the groceries today. So she would stay with Andrea. She knew what was going on. I had the medication there, the pill, the list, everything she could just take right over if something occurred. And I went and I did groceries. And then I might have gone for a walk in the park also. So she knew I was out for X amount of time. And then when I would come back in, you know, we just kept on going. And then getting home, again, the same things. And you have a greater environment to deal with, but at the same time, Andrea was recovering. And so she was starting to venture out of the nest, so to speak. And so she would go on walks. And so we went with walks and we took our walks. Within a couple of weeks, she returned to riding her bike. And so that was great. And I think about 3 weeks after the transplant, 3 or 4 weeks, she was so eager to start driving. So she started that. So as she started to blossom and continued her healing process, it gave me some time to step back, let her do her thing, and let me regenerate myself as well.
Can you explain what the Caring Bridge is?
Caring Bridge is it's an online program that you can set up for. It's like Facebook. You know, you keep a private network that you have just for your friends or family. You send them invitations, and then you can post messages as to what's happening with your person, and you get responses and on there. It's like a little chat room in effect. You can chat back and forth. It's there, I guess, for as long as you have an account. I need to go back in. I haven't been back in a couple of years, but it was a great resource. It kept everybody updated. They would ask questions. I could answer those questions. Andrea could partake as well. So it's a great tool. Just get online and Google Caring Bridge.
The other question is, how long before she went back to work?
Andrea was back at work, let's see, I believe in October. She was released. We were back in Dallas in August, and she went back to work in October. Now, everybody's different. Every journey is different. So I think the most important thing for you to do is don't measure yourself against what everybody else is doing. Just know that what your goals that you set and her goals for what she wants to accomplish, you keep those focused and in front of you and moving forward to attain them. Some people didn't go back to work, but again, it's the sense of normalcy that you want to return to. So it all depends on their health and when the doctors release them.
Okay, so our other two moms that were going to join us, I don't know where they are. I mean, sometimes, Zooming is just, there's a time change, number one, like there is in Texas. And number two, we're hoping that they'll join us soon. In the meantime, there's so much more we can talk about here, some more discussions. So,
Certainly.
It's certainly wonderful that you find things to do and find things that you can get away from, but not everybody has that luxury. And so, for example, Kathleen and I keep talking about us because we both lost our moms and we're both from families of 7 kids. And so it was that's another issue I think that needs to be addressed here is, I'm the youngest and my oldest sister and I were my mother's main caregivers. And in between that, we had other siblings that were not able to be here and help very often, or sometimes we found that the boys in the family, were just a little more standoffish and not very available. And so there is that element of caregiving, not only to younger people, but to anybody, that, sometimes there's a little dissent, that happens between the siblings, which has all been repaired, but when you're going through it, it can be very, very difficult and just kind of put some distance between you and some other family members. Did any of you did you go through that, or did?
I did go through that. We had Andrea's younger sister with us. She was actually Andrea's donor. And so it was great that she participated, obviously, in her own way. But then, of course, in her giving care to Andrea as well, she participated with us everywhere we went. Kathy was with us. She attended all the doctor visits. She knew what was going on. She did have to return to work. So there was a time that we knew all was coming, that she would be departing. And it was so funny. We brought the cat, our last pet, with us. And I stayed in the hospital and Kathy stayed in the apartment, and she took care of the cat and of course joined us on a daily basis for as long as she could, between getting herself recharged and rejuvenated as well, and then spending time with us, and then going home to take care of the kitty. When Kathy left, even the cat missed her. We missed her, the cat missed her. Everybody was like, "Where is Kathy?" So it was wonderful that she was there. I would, if you have anybody, whether it's another family member who's willing to do that, I would strongly advise that. It also helps people stay in touch with what is going on. It gives them a reality check as to, oh, this really is happening and this is what it looks like. Andrea's older sister came in and stayed with us for a while, and so she understood what was going on as well. Several of Andrea's friends came in, and that was great to see new faces. But no, we didn't have any dissension, but I could certainly see that would be an issue, as you had said, and that, the guys stand off a little bit. And of course, those who are caregivers, it's your natural energy to step forward into that place and assume the role. That's just the way you are. And obviously you're not doing it to exclude everyone. You definitely want everyone's help. But not everybody can do it. It's a very scary situation. As we know, everybody doesn't know, what's a transplant mean? Does that mean she gets a new arm or she gets a new finger? Or it's like, oh, no, 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 and there's a lot of unknowns. And the people are curious and some aren't. And, you educate those that are interested and want to participate and welcome that and definitely helps.
So there are two questions for you. One is, how old was Andrea when she had the transplant? And what can one expect as far as the responsibility after insurance for the cost of a transplant these days?
So Andrea's age, she was it was 3 years ago. So she was 69, 70. So she was bumping the edge of the transplant edge. And so that was one of the reasons that we made the decision to move forward. Insurance. Andrea's job covered her insurance. Andrea's job covered her transplant and paid for everything, which was fantastic. She also had Medicare. So she was fully covered. And there are resources out there, which I know, and you and your team can speak to in terms of financial assistance, medication assistance from pharmacies, whether you're on clinical trials or other financial resources and programs that they have available. I was aware of those. We were fortunate enough to not have to engage in it just because of Andrea being as a Medicare age. So I think I have to kind of throw the ball back in your court a bit to answer those insurance questions. Through the process of the transplant, though, there were a couple of things that came up. We went back to the hospital, spoke with them. Everything got ironed out. There were no real issues to take care of because all the insurance was approved in advance. They knew what would transpire. After she got out of the hospital, then she had to pay for medications. We were off of a good deal of the medications that she had to handle in about 6 months after her transplant. So they're not inexpensive. They are costly. But the good news was she didn't have to be on it a long time. Everybody's different. And I would certainly you definitely want to explore those financial resources in advance so that if your care and medications extend for a longer period of time, that you want to have something in place that you can go to and enact.
So Sarah will be joining us, and we hope Sylvia will be joining us pretty soon. Sarah's in Texas also, and she thought it was Central Time, so she'll be with us. And she's a real good person to hear from as well, because she's done a ton of work in trying to get insurances to cover her son's Pegasus and healthcare. There was an issue with Medicare not covering transplants, and it had to be, very specific criteria. And, just for the audience, there is kind of a cap that our researchers and clinicians try to stay within in terms of when a person should have a transplant. But there's a list of criteria that they have to meet, obviously. But there are many younger people now, getting transplanted that are starting to change. And oh, hi, Sarah, that are having some things, go on. But one of the questions was, how did you manage taking time off of work and caring for a family member? And I can tell you from my experience, because it was every 24 hours, every other 24 hours, I was with my mother. So that's 3 days a week. I was, caring for her. I went to my boss and said, this is happening. And that research project I was talking about earlier, I worked with, one of the project pieces was to work with HR departments. Instead of a maternity leave, that baby boomers got a caregiver leave when stuff like this happens. So you could still get paid, or the Family Leave Act, obviously that comes into play. But but they were very, very wonderful. And most people will be pretty wonderful, I think. It's not always feasible because it's not all, sometimes you take a cut and pay or, things like that happen, which I don't think is so wonderful, but it does happen. But we'll get to some of these other questions because I really want you all to hear from Sarah and Denise. Thank you, and stay with us because I'm sure there'll be other questions. But
Certainly.
Sarah Walsh is joining us. Hi, Sarah, can you hear me? Okay, you can come on. Oh, there you are. Hi, sweetie. I'm sorry about the time change and everything for that glitch, but we're really happy you're here because, as I mentioned, Sarah has a young son who has an MPN. So can you just share your story, Sarah? And then I'm sure you're going to get a lot of questions from our viewers.
So my son was diagnosed at the age of 8. He is now 12. So we are 4 years into this process. He was originally diagnosed with ET, and they have now changed that diagnosis to PV. He started out on hydroxyurea initially, and then after about 6 months, we switched him to Pegasus interferon, and we have been homeschooling for the last year and working. So as you can see, I'm in an office. Today is my first day back at the office, so things are a little bit crazy, but we were able to get the vaccination, so my husband and I are moving forward. But at this point, I think, is that what you're looking for?
Well, Sarah, so how do you manage, because you and I have talked about this many times over the years, but how do you manage caring for your son, having a full-time job, caring for an additional son and your husband, and when your son, I'll call him Jedi, when he has issues, like the last time we chatted, you said, he's getting neuropathy or like his feet were bothering him and so on. So tell me how do you deal with all of that? And how do you find time to get yourself back to center?
I don't think I did a very good job with that initially. So he was diagnosed in November of 2017, and by February of 2018, I had pneumonia. So I would work all day, and then I would research all night, and then I would work all day, and I just drove myself it was just too much. I think I talk a lot about it being a marathon, not a sprint, and I think there is truth in that. And then about a year ago, I saw a thing on a video on YouTube, and it talked about putting in airplanes, they always say, put the mask on yourself first and then put it on who you're helping. And it really resonated with me, and that made me start to give myself permission, I think. I think a lot of times, especially as mothers who are taking care of a child, you're always supposed to give to your child, and it's really hard to see your child hurting. I think it's hard to give yourself permission that you're going to do these things and you're going to take care of yourself. So I started getting my nails, little things that ended up just giving me the time to be okay. And the other thing is a friend of mine not that long ago, actually during COVID, she said her brother had an illness in their family, and she talked about how she started seeing her parents, instead of walking together, one would take care of the child and the other one would go ahead and take a break. So they were no longer walking side by side through it. They were more switching off. And that really also resonated with me because I started seeing me and my husband doing that in our relationship. So ultimately, in the last year or so, we've really tried to focus on, yes, we love him, but we also need to walk together. And that means spending time together, even though, yes, he's sick and yes, he's got these things, but we still need to connect, and we need to walk together through this. There's alone time or break time for each other, but there's also relationship break time, and then there's our family. So I think those are probably the two biggest. And when I get my nails done, I meet a girlfriend, or I might go out for a glass of wine, but giving myself that permission became very, very important.
So also, Sarah, I want to talk to you because you've done so much work in trying to get your son's medication and so on. And Sarah's a huge advocate and has done a tremendous work. And we recognize her often because she's just done tremendous and a tremendous person for other parents with children with MPNs. And so, Sarah, I know you had to jump through hoops to get Pegasus for your son. Can you talk a little bit about that, that frustration, and as a caregiver and also as an advocate, what happened and how did you handle that?
So Pegasus is approved for hepatitis C. It is not approved for MPNs, and it is not, when I say approved, I mean the FDA recognizes it as a drug for hepatitis C. It doesn't necessarily recognize it as a drug for MPNs. The NCC, and I don't know if I'm saying that right, NCCC, the National Cancer,
NCCN. Yeah.
How do you say that?
NCCN.
Yeah, NCCN, yes. They recognize it, and that has made it, in, I believe, 2019, they recognized it as a drug for MPNs, and that's made it a little bit easier. But because the FDA hasn't recognized it, insurance companies don't necessarily want to approve it for MPNs. It's not a cheap drug. So our cost typically is $1,000 a month, and it's considered a specialty drug. So it's not also part of your pharmaceutical, or if it is, it's an asterisk. So it goes against your full deductible instead of just your pharmaceutical deductible typically. So what does that mean? For a child, it means that we have to fight to get, well, and adults as well, you have to fight to get it approved. The easier part, I think, for adults is you're typically, or if you have an MPN specialist, they have the documentation, or they do it on a regular enough basis that it's become more of a process for them. For a child, we're working with a doctor that has never, this might be their only MPN patient. So they don't necessarily understand the pieces of getting it through insurance. And so ultimately then it became a process. This is the first year where once I got it approved, it seems like it's easier on a monthly basis to get the medicine. Although I now get a text message and I know that there's an 800 number calling, and I sit on my phone until that 800 number calls. Because if I have to call back, that's an hour phone call. If they call me, it's 10 minutes. So I think as what we have to do is you have to send the approval, and your doctor sends in the approval, then they reject it. In Texas, so every state's a little bit different. In Texas, they have 3 days to give you final approval. Because you're now saying, okay, I'm challenging it. They have 3 days to get back to you. But insurance companies play games, right? Specialty drugs, you have your insurance company, they outsource it typically to a pharmacy. That pharmacy then also outsources it to a specialty pharmacy. So then they're saying that each approval has to go through the insurance company, the pharmacy, then the specialty pharmacy. And they don't, in the world of electronics, nobody talks to each other. So, and each person, and you're not typically dealing with somebody you're not talking to the pharmacy. You're never allowed to talk to the pharmacy. You're only talking to the customer service representatives that really don't know. And it's not their fault. So it ends up being, I wish I could tell you it's a short process every year. It's not, it's hours and hours and hours. And then I've learned to document everything. And I have started to talk to my representatives and my state senator about what that looks like for me and how that there shouldn't be those loopholes.
Mm-hmm. Absolutely correct. And so we all know that Pegasus is an injectable. And so I'm assuming you inject, or has he learned how to inject yet?
So he still has some pain in his arm. You know, getting the vaccination for COVID really gave me a new appreciation for what he goes through. I was talking to a friend the other day. I was like, it gave me a new appreciation for what he goes through every week. I mean, I did my second shot, I got really sick, all of those pieces, and he doesn't get really, initially when he started on Pegasus, he had flu-like symptoms for 2 days, but on hydroxyurea, he was sick every day. So the 2 days we had no problem taking. Now he says he feels a little bit achy. And then he started to have neuropathy. But his muscle aches. So because he's already having trouble with his feet, we injected in his arm for him, but he gets it already. So he knows Friday nights, we pull it all out. My husband and I take turns injecting because that's our agreement. But he gets the shot ready to go. He knows what he needs to do, but I've done that intentionally. So originally when I started out, I paid him $5. Every 30 seconds, he made me delay him giving the shot. I took $1 away. So he didn't believe me that I was going to do it. So the first time he got $3. Sorry, it took him a minute to let me give him the shot. So, and now he doesn't, he rates us. So far my husband's getting more 10s than I am. I'm a little down on that. But so now it's, 10 being really good, 1 being really bad. I don't know if he's messing with me at this point, but he rates us every week. We get a rating as to how good our shot was. But I've done that intentionally because I want him to be involved, because he has to take ownership on this. This isn't a year and we're done. He's got to take ownership, and he needs to understand that his decisions impact that. And he's gained some weight over COVID, and I know that's partly also the buildup of the steroid, his feet hurting. But again, it's allowed us to have the conversation of, when you put food in your mouth, you're making choices, and your body craves sugar. Sugar feeds cancer cells. So because your body's creating cancer, it's craving sugar more than it would with your buddies. So that craving, you have to know that, yes, I'm craving it, and probably more so than your friends. Sorry, that's part of the deal. But by making choices, you gain weight, and maybe even, again, more so than your friends because of the buildup of the chemo in your body. But, maybe it's okay to eat a salad. He calls it rabbit food salad, or do different choices. But those are decisions he's going to have to make, right? We as adults have to make those decisions. So it just is maybe a little bit more important for him.
So one more thing, and then I have a list of questions here for both of you. But Sarah, I just want to point out to our audience that also with Pegasus, are they sending the actual dose he needs, or do you only use a certain amount of that drug in your injection?
This is very frustrating to me because so it's 180 micrograms. That's how a doctor will discuss it with you, but it's a 1 milliliter vial. So that 1 milliliter vial costs $1,000. He only uses between 0.3 and 0.35. So, but because we've pierced the seal, we have to throw the rest of the vial away. I know a lot of adults will reuse those vials, but we have the additional concern of CPS showing up at our door. So our choices become very limited, because if he were to get a bacterial infection, or if he were to, something negative were to happen because we reused a vial, we would then have to potentially go through the CPS courts. So, and knowing all of that, I tend to be really careful. Have I been forced to do that because I'm fighting insurance companies and I don't have medicine? Yes, I have. Mm-hmm. So then we have to throw away the remaining vial. Mm-hmm. But there is a network of us moms where if we know that somebody can't, we've now gotten to the point where if there's some people that can't for some reason get a vial, we'll work together with each other. Because we have to.
I mean, that's been an ongoing issue. Years ago, when Pegasus was first discovered to help, it's been around obviously, but when we realized that it was helping MPN patients, some MPN patients, our organization, well, I was working at the MPN Research Foundation, we met with Roche, and who at the time owned it, and Genentech. And basically, it was more of an issue, like everybody has a different dose and how are we going to do this? And, but it's so unfortunate. And Sarah's absolutely correct that there are many adults that save it. I mean, they put it back in the refrigerator and save, use as much as they can from that one vial. And this is just one of the issues that, we deal with in the MPM world. And Sarah, as the mother of a child that needs this medication, it's got to be extremely frustrating. So what coping strategies have you personally found helpful when you do get overwhelmed? We kind of mentioned this before, but and I know all of us, we go see our friends or we go do something, but are there any other things we're missing that Sarah, I'll start with you and then we'll talk to Denise again, but you mentioned some things that you do, like go get your nails done now and meet with friends and, now, especially since some of us are fully vaccinated, we can kind of get out there again a little bit, but let's say you've just had a really bad day and what do you do?
So I haven't gotten to have my nails done in a whole year. So
me neither.
So that is on my list now that I am fully vaccinated, but I'll probably have to find a new nail place because I want to find a smaller. I still am concerned because Jedi can't get vaccinated because he is only 12. And we have a 15-year-old who cannot get vaccinated either. So we still have to be careful. It just looks differently according to his doctor, it's less than 5% of us being able to transmit it to him. So we're banking on that at this point because I do need to go back to the office. So what I have done a lot is I've tried to find just areas to sit, which, well, a couple things. First of all, I have a really cool group of friends. We've met every Saturday morning and we walk trails. So we usually walk about 4 miles every Saturday. I did have and I cannot tell you how incredibly grateful I am. And I've been very intentional with those friendships. I have another group of friends that we have celebrated birthdays together. We've met in parks. And this one group that I meet with Saturdays, I had a meltdown in November. I lost it. I lost it, and I called them, and Sunday afternoon, I'm like, I need help. And they met me, and I sobbed the entire time we were there. I sobbed, and I'm sure people were walking by going, well, did she get beat up? I mean, what happened to her? But just having those people in place that can come on and I've done the same for them in their situations, but just having those people in place and not necessarily other mothers of cancer patients. I think that's great to have too. And we have that group, but people that are also close in my vicinity, like most of the mothers of MPN patients were spread all over the United States. So it was nice to be able to have a group that was closer. So for me, those friendships have become, and maybe that's age, become more and more and more important.
I would say, undoubtedly having friends that, that you can call. And I mean, just recollecting, some of the stuff I went through with my mom and feeling like I didn't want to call some of my friends because I felt like I was becoming a burden to them sometimes because there was always so much going on. And when I would tell them I had a bad couple of days, they would say, why didn't you call me? Why? And now I've learned to do just that. And I'm so proud of you for doing that and you're lucky because friendships are enormously important throughout life. But I do think as we get older, they become more significant to us. And especially when you're caregiving and going through, some particularly difficult things. But Denise, would you like to chime in here?
Yeah, I'm more physical oriented when it comes to needing an outlet. I find that gets that energy out of me, helps me get perspective, because I can go as hard as I need to, or as hard as I feel like I'm up for, whether I go for a ride or I go for a walk, run, or just go out there and beat the ground for a minute or two, just to get it expressed, because I still have to come back and say, this is life. This is the journey. I can only do the best that I can do, and I can put my best foot forward, and that's it. And I'm not responsible for anybody. I'm responsible for as much as I can give to Andrea and make things right, but she has her part in it as well. And the doctor and the transplant team have their part. So I just really had to come back to center and grounded and just say, you're doing the best you can. This is all that you can do. And just show up every day, the best form that I could be for her at that time. And then just keep going forward. I did a lot of meditation and breathing.
So this question is just such a perfect question, that we all grappled with probably, but is it feasible to be a devoted caregiver if you keep working at your other job? And I would say yes, that it worked, that it did work for me, but Sarah, what do you think? Because you're doing it day in, day out.
So I have some flexibility with my job. So I'm going to start out there. So I'm a financial advisor. So I have appointments and I have some flexibility. Does that mean there aren't nights where if I've had to go to the doctor with Ian, then I'm not, I keep saying his name, but we try to be really careful with his name but I'm the one breaking all the rules. I try to be really careful. So if I have a doctor's appointment for him at the oncology office, local oncology office, that's a half a day lost work. So if he needs to go to the oncology office once a month, that means I've missed a half a day every month. And that doesn't include the MD Anderson, his normal doctor's visits. They want him to go see a specialist for learning because there's no iron in his body that gives symptoms similar to ADHD, but ADHD medicine can't be used. So they want MD Anderson wants some cognitive testing done. So I'm trying to figure all that out. So that also is doctor's appointments, correct? So there's a lot of pieces that are constantly moving. So I want to just acknowledge that and put that out there. Like, as a parent, and I am not a single mom. There's two of us. So I don't do dentist appointments. My husband does all the dentist appointments, for example. So I don't even schedule those. He schedules them. So I also want to acknowledge that, because I think there is different when you're on your own, if you're a single mom, or if you don't have flexibility, it does become a lot more difficult. That doesn't mean that it's not like 10 o'clock at night, though, on a night where that happened, where I've taken him to doctors or whatever, that I'm working, or we're at MD Anderson sitting in a hotel room, I'm working. So I have the flexibility to do that. And so that's made it easier. And the people around me are also helpful, staff, the partners in the firm I'm at, they are all understanding. So I have that. So for me, I have been able to make it work. Does that mean my business hasn't been harmed from it? It has. Has it made it harder for my husband to do the things that he needs to do as far as his employment? It has. So I think there needs to, I want to definitely acknowledge that it does make things more difficult. And I definitely want to acknowledge that I have a great situation to make it so that I can make it work. But I also have been very upfront and open with people as to this is where I'm at, and this is what I can do, and this is what I can't do. And even as I've discovered it. So the short answer is yes, you can. The long answer is it's a lot of work you can get tired a lot. It's hard to stay on top of everything all the time. I use a planner. I write everything down. I have electronic pieces. So there's a lot. I've learned different systems that have helped it a lot too.
And, you know, and for the sake of conversation about this, I remember even though the organizations were pretty wonderful to me when I went to them, one was at a hospital before I started working at the MPN Research Foundation. And the hospital folks were fabulous to me and just said, do what you have to do. And as I said, it was every 24 hours, but it still was stressful because when I was caring for my mom, I was still thinking, oh my God, I should be doing this, this, and this. And I hope that I can get that project done, you know, and in the amount of time it's supposed to be done. When I went to the foundation, my mom recovered from a cancer, then became ill again. I have to say, you know, I discussed it with the folks at the foundation and basically moved back. I moved back to where my mother was and took the train into Chicago every week. But they were pretty wonderful and understanding about what was happening with her and what role I had to play as a caregiver. Sarah's absolutely right. Not everybody's going to have that situation. And that is when you really need to pull the forces together in terms of, you know, for example, I'm one of seven. If, as we were talking about earlier, if there had been no way for me to be as participatory as I was, we would have had to call in the forces and say, look, this isn't an option, you have to help. And as it was, they were able to, you know, come and go as they pleased, basically, while my sister and I did most of the work. But my point is, not everyone's going to have a job like I did or like Sarah has, and or be able to have that flexibility, be able to have an income that supports it, because it's not, you know, most of us do need to work and bring money into the household, and then you have this added responsibility. So it is not always easy. Denise, would you like to add to that conversation?
Yeah, and mine is similar. I have flexibility as well. I'm self-employed, and at the time of Andret's transplant, I was in the process of transitioning from one position to another one. And the folks that I was transitioning into, I let them know what was in front of us and that this could be, you know, it was definitely a minimum of 4-month absence. And then from then on, it would just be, you know, there would be time periods that I would be out, whether we were attending doctor visits or whatever, what have you, that came up. They were very understanding and recognized what I could do and what I couldn't do. So I did take on, you talked about, Kathleen, at one point, how your memory improved. I took on a project that we were implementing, and it was a database project. And so I did have every moment I took, or every moment I had available, I did go and jump into that database and build it and make that happen. So it was a great way to still feel engaged and working, and yet still remain available for the care and the transplant that was occurring, and keep going forward. So the flexibility was there, and I was very grateful for it.
So a lot of our partners, and that is not just industry partners, but organizational partners, NORD, LLS, some of those folks do have some programs in place to help caregivers, and maybe it's you know, car service, or you know, a taxi or Uber or something to an appointment. You know, so not necessarily a check handing to you saying, here, this will help you get through the week or get food for the week. But our industry partners, ironically, many times will ask us, you know, what else should we be doing or could we be doing to help with this specific area? And so as caregivers, Sarah, I'll start with you. If you had a wish list And you could say, you know, this is what I think is very important. It's needed in the community. It's needed for those that do not have the flexibility I may have, or the partner that I have, or whatever. You know, what would you propose to some of the organizations that provide so much for caregivers, or provide some things for caregivers, and for those organizations that want to?
For the caregivers or for
Yeah,
the patients?
Caregivers, for the caregivers.
This is going to sound very first world. My father-in-law asked me that question 2 years ago. And I asked him for cleaning ladies.
What a wonderful idea.
I felt like my house was falling apart around me. Like, I'm really good, to Denise's point, sometimes finding something to do is to distract you. So I'm really good at finding a project. I repainted the main floor of my house. I mean, I find a project, but just have, you know, making sure the toilets are cleaned every other week. I mean, I live with 3 males. Just having that, and I haven't had it during COVID, and I realized how much that helped me. And just knowing, I mean, I looked forward to that day. I came home and the house was just immaculate, and it didn't stay that way for very long, but just having that peace, and then there are other times, so Ian was diagnosed in February 2017. My oldest was hit by a car in November of 2017. And one thing that people really did is sent us meals. So I don't know if there's like a HelloFresh where they can send, and that was helpful, just knowing that night. Or there's a company called 5 Meals 1 Hour, where it's a subscription you can get, and you can go sign in, and it'll give you all the recipes and all those groceries that you need to buy. So just little pieces that take up a lot of bandwidth in your brain, but yet aren't necessarily big in a sense, but they do take up a lot of bandwidth. And I think sometimes too, breaks. It's a little different for us because we're dealing with a child, but my husband and I, we have people, so we have family members that also help. We have a father-in-law and then my parents, but they don't feel comfortable with us leaving the city. So that means we don't get to go anywhere other than just within the city. So they have let us go to conferences. That sounds so bad. They have worked with us so that we could go to San Antonio for a conference, but that's the furthest my husband and I have been since Ian's been diagnosed, Jedi's been diagnosed. So I think somehow giving those little, and I don't know if caregivers with adult patients want long periods of time away, but maybe even, you know, a day away where they can go and to a spa or something where they, for a moment, it's about them and not necessarily about their partner or spouse, or in our case, child. It's about they themselves.
So you said a couple of things that resonated, and that is, you know, through social services and some other through insurances, sometimes they do offer a person to come into the home sometimes. Now, I know it's different with COVID, and that's probably going to be the case for a while, but there are some services that they do provide. And so it's important for you as a caregiver to check in with your insurance company, check in with other organizations that support situations like this, because I mean, you obviously you might see an occupational therapist sometimes, or physical therapist sometimes, not always, but that usually is covered by insurance. But I remember being told that, yeah, we can have somebody come in and prepare a meal and clean the house, or you know, something like that. So those are important things to remember, very important.
The other thing I would suggest is we weren't on the first list for COVID shot. So because it wasn't one of us that was sick. So it was because our child was the one that was sick. And Dr. Cassine, we emailed and we were talking to her, and she said that they were fighting that battle in New York as well. Like they can't, so understanding that it's, those children are a population as well that is impacted significantly by this. And as parents, that would be something that I would hope that the next, if we're, I pray to God, we're never in a situation like this again. But as partners, I think a lot of them are the pharmaceutical companies, that is part of the conversation in the future is it's not just if there's adults that have extenuating circumstances, it could also be caregivers of minors who have extenuating circumstances.
Right, that's a very good point. Denise, did you want to add anything to that?
It certainly echo what you guys have said in terms of the groceries and cleaning the house and having food. And it is just a nice break to say, oh, I don't have to think about this tonight. But you also have the structure of the house that needs to be taken care of. At least have some kind of network that somebody could come in and take care of the lawn or something that's broken. It's not, something that you don't have to deal with. And you can say, hey, Joe, I've got this problem. Would you just come fix it? And they just come in and figure it out and fix it. Just somebody you could call and say, hey, I need help to make this happen. And I also think, I know this is kind of strange, but caregivers for caregivers. So to speak, where you have a caregiving network that is in tune with transplant and understanding what it means. And of course, everybody's journey is different, but at least they have some sense of what's happening so that they could step in and take over for the day or at least an afternoon or several hours or an extended period or weekends where that they know exactly what to do. You would, of course, leave information for them for your specifics to deal with. But once they had it under control, then you could go away and know that you were a phone call away if something came up, but it would be handled. It would be taken care of. And I think it would give a sense of relief just to really release the tension and say, okay, I've got a backup. If something happens to me, I've got a backup I can call. If I'm in a spot here, I know I can call this network and they can come in and take care of things for me. So that's a kind of a long-term type of suggestion, not real immediate, but I think it would be a great asset for people with transplant and all the MPN diseases, because they can be extended caring over the years.
I would echo that. I have a client right now whose husband he just got a transplant. He has MF. He got diagnosed with MF, and she has to go home from the hospital every night to let their dogs out.
Yeah.
So, and she could probably pay somebody, but just even if it's a week where she doesn't have to run home every night. I think that would be, just the little break or, but I think too, people that have gone through it, Denise, I remember going to a conference where Denise spoke and just listening to her and having her willingness to share the information. Those people are golden because you don't think about certain things or things take you by surprise. And I think as a caregiver, the less it takes you by surprise, because the ground is already shaky. The person that may be ill, for me, Jedi, he doesn't really understand what's going on. I mean, he's starting to understand more and more, but under me, the ground is shaky, it feels like already. And then to go in and, for example, find out that the liver can be impacted because of interference. I didn't even know that. And then it took me off guard. So I think having people with Denise's knowledge and finding a way to gather that, which you've done a really good job, Anne, but even more so just a way that we can take be taken less and less by surprise, just because the ground it feels so shaky already. And just, I don't know that I'm communicating that in the way that I would want to, but it's just, it hits you. It's all of a sudden, oh, wait, what? And then it takes you a little minute to process. And that minute can be a week or 2 weeks or a month or 2 months. And then if you're already struggling, it's like, wait, I can't handle another piece right this second. And whereas if you know what's coming, you can kind of brace for it.
That is an excellent, excellent point. And I'm sorry to keep sharing my own story, but I have to tell you, my mother had this very rare cancer. She was getting treatments regularly. In fact, she ended up getting 42 treatments, which was that was a lot. She was a very tiny woman. Well, when we sat down with the oncologist and he said, your mom will make it. This is not this is, we'll do this. No one prepared us for how sick she was going to be. No one. I mean, we knew that she would be sick, but not to the extent that she was. No one told us that the treatment she was receiving was, radiation was burning her from the inside out. So 3 surgeries later, no one prepared us for how, they took us from the beginning to the end, which was, she's going to live through this, she's going to be okay. So I remember saying to the doctor after we got her well and got her through the surgeries and got her through all of that stuff, that I wish we would have known. I wish we could have had some knowledge of this could happen, and this is what we need to prepare for. And so it's a great point well taken. That you're on this medication and you had no idea that this could be, affecting his liver. And psychosocial things that go on with caregiving, at some of our events, when we've had the breakout sessions, we hear a lot from the spouses that, when he or she isn't feeling well, I don't know what to do. I feel helpless. I feel completely, I can't stop the itching. I can't stop the night sweats. I can't help this person sleep. Any thoughts just off the top of your head, like anything you can impart to those folks? Denise?
Yeah, and I definitely echo what Sarah and you have said, and the education and the experience of what a transplant and or the process of the disease looks like is huge, so that you do know what to expect and you do have an idea. And I think to support that goes on with having a team, a medical team that you can go to with questions. And they, that they're a reliable source. And then to go beyond that, and of course, and just continue to explore and educate yourself with as much information as possible that you can gather. And going back to patients and people that have had transplants makes a huge insight. You get pieces on it. I know that one person, Andrea, was reading during the transplant and said that I use glutamine to help heal the mouth sores. And I was very familiar with glutamine. I knew exactly what she was talking about. So that when, of course, as Andrea healed through the process, we couldn't, of course, administer glutamine while we're in the hospital, but it was something I kept in the back of my mind to say, okay, down the road, if things get a little weird, I know I can use glutamine. So I think, also looking for alternative therapies to help support the symptoms. Because sometimes you're just having to treat the symptoms. And that's all that you can do. It's the course of the disease. So the education is enormous, and the other sources, whether it's through MPN, medicals, people support, any tips that you can get. I always started gathering information and keeping a file as to what resources I might be able to use for the mouth sores or the neuropathy or the itching or whatever the things came up with. And so those are monumental. And I think and even in your presentation where you talked about initially the anger and the depression and the emotions that we feel, all of that is just as critical to your continued support and being able to show up every day for your loved one and be there for them and just do the best that you can.
Sarah?
I'm going to piggyback a little bit off of what Denise said a little bit. So I had a really hard, like I recognized, I think there's a grieving process that happens through all of this. And I recognized that in Jedi, but I didn't recognize it in myself. And initially I felt like, why am I grieving? Because I'm not the one that's sick. And I wasn't okay with it, if that makes sense. I wasn't okay with me grieving when I wasn't the one sick. But I think there is a grieving process. And I think that and it isn't the 7 steps and you're done. It's the 7 steps and you may repeat a step a couple times. And I think then add a pandemic on it, and there's a whole nother level of, and it's not just the caregivers, right? My 15-year-old also went through a grieving process. And in a pandemic, when you are now saying, hey, you have to do your freshman year at home, and all his friends are going back to school in December, and it's like, sorry, you're going to still be at home. He had a grieving process. So I think recognizing those pieces, even in the midst of not just the person who's ill, but also in the people around in the family unit itself, I think is really important. And giving yourself permission and giving everybody else permission to get angry. It's okay to be angry. It's just as okay to be depressed. I think sometimes we don't it's okay, you know, we talk about taking the pillows and beating things up, but we don't talk about the part where it's rough getting out of bed today. And I think we all, as caregivers, have that, but also recognizing that other people in the family unit might have those same things as well.
Excellent point. I did mention grieving in the little presentation I did at the beginning, so I'm so glad you brought it up again, because as I said, and as you so eloquently put, you know, they're going through their own grief process, the patient is, and my life is never going to be the same, you know, so I have to say goodbye to this life I used to know and get on with life and figure out, you know, I always say I have 2 mantras. One is never wish time away, and the other is life is a series of adjustments. And so, and it's just constant, as we all know. So, but the grieving process of, you know, saying goodbye to, this is well before my mother passed away, but, you know, to that woman I knew, you know, to the person I used to know, who was healthy and who was vital, but also, like Sarah, you said, it's grieving where I am in this world with this person, you know, like, and you're right, you're so right about feeling some guilt about that, you know, that why do I feel sorry for myself, you know, and I think it's a huge piece, huge piece. Any more? Go ahead if you have more to say about that.
Well, I think as a mom, you're grieving what could have been, right? So Jedi was my natural athlete, and we had to pull him out of all sports because he was a soccer player, and the next year he was going to have to start heading the ball, and there'd already been a concern of brain bleed. He had to have an MRI because they thought he had a brain bleed. So and instead he's having trouble right now walking. But I mean, to go from a natural athlete to he limps around the house because his feet hurt so badly. So I think, and as a parent, that's hard to watch, and he's struggling with it. But then he's also written a Roblox game. It's just a video game that kids play, and he's had almost $2 million of or 2 million visitors to his site, and it's generating income. I mean, they get Roblox, and he says, you know, Mom, I might need to start a merchandising. I'm like, what? No. He's like, well, right now I'm putting my Roblox back into advertising my game so I get more visitors, so I'll get more money so then I can do merchandise. And I'm like, yeah, you produce some income and we'll talk, okay? But I mean, so they do find things because kids are resilient, but at the same point, it is hard to see. We're in Texas. Texas is the world of athletes and sports, and that's how the boys here connect, and a lot of girls too, don't get me wrong. And as a parent, it's cool to have a sport because it does keep him, like with my 15-year-old, he knows that if he does anything, the coaches will kick him off the team. So he's very careful in what he does. We're not going to necessarily have that checks and balances with our youngest.
Right, right.
So I think there is some of them that so yeah, I think it's not just a grieving process of, oh, he got sick and now he can't play soccer. It's a grieving process of, this is going to look very different, and there's different steps along the way that it's going to look different, and you realize it again. So I guess I've learned, I'm very type A, so I'm learning to be more generous with myself, and my husband, you know, like he's got his stuff too. So and my parents, you know, my mom's got ideas on how we should treat it. And so I just, yeah, I think I don't know that I can say much more on it because I'm still kind of figuring it out myself, because I originally thought, okay, I've grieved and I've moved on. I think the pandemic taught me that there will probably be steps along the way where I continually will grieve. And we haven't gone through a transplant like Denise has. We were originally told that he would probably need a transplant within 5 years. And so far, Pegasus has kind of held the line for us. So he's been on it for 3 years, and he's still looking pretty good. So, and we are also very blessed in that my oldest son is a perfect match for him. So we don't have that concern, whereas other parents may have that concern where is the match going to come from if there needs to be a bone marrow transplant. So, and that would be the other piece, Anne, is as you talk about caregivers, I think that is a big concern in the back of your head. If you've been told you're probably facing a transplant, you know, is there ways that we can, as a community, do match.com or do fundraisers to get people to submit to that, because they may not need it right now, but it's much easier to find your match now than, you know, just because it is a huge thing in the back of your mind. Oh crap, are we going to be able to find one? So even if we get people into the database now, maybe it can be helpful later.
We do have groups that have done saliva things at races, different events, which is fabulous. I think it's great. And we had someone online or on our transplant program that when she told me she was doing it, I said, if you don't find a match, let me know, because we're both Middle Eastern. I thought maybe I would be a match for her. As it turned out, her daughter was, I think partially anyway.
Yeah.
But, you know.
I think I know who you're talking about. Yeah.
Yeah, you said something very interesting, and I think it really will resonate with some of our viewers, and you know, not just mourning the illness, you know, that your partner has the illness, but you know, a lot of patients that are finally getting to this place in life that says, okay, we can take a deep breath, you know, and kind of COVID has had the same effect on me. You know, it's like, finally, I'm getting to this place where I can enjoy life a little bit more and be out there. And I'm not complaining. I'm really not complaining. But the point is, what we've heard in some of our caregiver programs is we finally moved to where we, you know, our retirement community, we're very happy. And then suddenly she can't get out of bed, or he can't get out of bed because of the fatigue. We we used to be so active, and now, I just have a different person sitting there because they've lost, they don't have the energy to do what they used to do. And they know what it's going to take to do some of the things they do. They don't want to meet with their friends anymore. There are a lot of things that go on with, if an MPN patient is having some issues. And so, Denise, before Andrea's transplant, was that kind of an experience that you had at all, that the two of you experienced?
We did. There was lots of adjustments prior to her transplant. She was on, in fact, we checked into a transplant when she was first diagnosed. And so there was a 10-year period between the initial review and the actual transplant. Actually, it was a little more than 10 years. And when we first went through the first review of the transplant, it was like, oh my gosh, let's run screaming from the building. This is not going to work. And in the time, technology, medical has moved forward. There's been a tremendous amount of forward momentum and progress on it, which I'm very grateful for. And I know that will continue to proceed. The swelling, the neuropathy, the water retention, the steroids, the medication side effects, the hydroxyurea, anagrelide, it's all there. And our constant mantra is, okay, let's adjust. Okay, let's modify. Okay, you still want to ride. This is very important to you. This is part of your psyche. This is part of your health and your way of dealing. Okay, let's get you an electric bike. Let's put a motor on this so that you can still go out and ride, and you can enjoy riding with your friends in your group, and you don't come back just absolutely exhausted and sleep for the next 2 days. So that worked. So it's just constant modifications. And I think the perspective's a little bit different. Andrea being more mature versus dealing with a child. So you have age and you have changes in your body that are more apparent as you get older, because there was like, I used to do this, I used to do this, I used to do this. And it's different from your child when you see your child blossom, and it's wonderful and it's exciting. So you don't know whether these are age-related issues that are causing things to slow down, or is it transplant issues that it's causing things to slow down? And, quite frankly, I look at it and say, well, you know what? It doesn't matter, because this is where we are and this is what we need to deal with. Whatever it is, how can we make it better? How can we make it easy? How can we get her to continue to ride? What do we need to do? And so, we're just constantly looking for those ways to continue your quality of life to the best ability that you can. Because to me, again, as I'm very physically oriented, I know that that is going to keep the energy moving, the energy flowing, keep you motivated, keeps your goals there, keeps you reaching for them. And Andrea's the same way. She doesn't want to give up. And when you give up and you become sedentary, I can tell you, I was with some friends and they had a doctor come over to visit with them, and the doctor asked them, did you have any pain this morning? And I said, oh yes, I had and so I could stop and think about that, but I don't want to. It's not important to me. It's attitude and your state of mind, your mental strength is huge in this. Yes, recognize you're gonna have those meltdown days. You're gonna just go, I can't do this anymore, but you have to just let it happen, let it flow, go through it, know that there's another side that you want to be at, and know that you want to feel better, and again, show up the best that you can. You have to be very motivated, but you have to recognize that there's going to be bad days, and it's okay. As much as you say to them, to your person, this is normal, this is typical, say it to yourself. Believe it. This is normal. This is typical. This is going to occur, and it's okay. I'm going to be better tomorrow. We're going to do this, and this is going to happen, and this is going to be great. And okay, this wasn't so great. So, okay, what else do we do? So just keep staying forward.
Can I
The
call
shoe
you?
is going to drop, and how are you going to fix it? The shoe will drop, and how are you going to fix it?
That's right. Well, we'll do whatever needs to happen. Just jump in with both feet.
I don't know if you heard me, but what I said was, something's happening with I keep bouncing off. There I am. All right. Can you hear me and see me?
Yes.
So, did you hear me when I said, if anything happens to me, can I call you?
That's the cheerleader in me. I do have to say.
I love it. I do think, I've said this to my granddaughter, I've said it to my family members that it's easy to stay in a weird place sometimes. It's almost easier than saying, I got to get out of this. I got to change this. I've got to make that move. And I know we hear this all the time. And I know to somebody that's in that place, it sounds pretty, like, oh yeah, well, that's great for you, but it's not going to be me. And that is, we have choices, and in every part of our lives and every place in our lives, we have choices. And if we make the choice to stay there, chances are we're going to be miserable for a long time. If we make the choice to get educated and reach out to other people and look for resources, if you are not in a position to do that, call us. We'll try to help you find the resources you need. But also in your circle of friends and family, and keeping in touch with those, as we all said, those relationships are so important. I have to tell you, I live alone. I have many friends and people in my life, but I live alone. And so during this pandemic, this was like the most amazing thing, to be able to Zoom with my family and my daughter and the grandkids and so on. It'll never replace in person, ever. But and as soon as I only let a few people in my house, and just so what I'm saying to those folks that feel alone and feel like there's nothing else, this is it. As you start to open your world up to some help or to some other people, you might find that you can form a group of, maybe at your church, in your neighborhood, in your workplace. And with us and other organizations, if you choose to not make that move, then you might find yourself feeling pretty out there and alone for a long time. If you choose to take a tiny step, just do one thing, that will help you get the necessary assistance you might need, or just to have a listening ear, just to have somebody to talk to. So as we wind this up, as always, I thank you both so very, very much. You both.
I'm sorry I was late. Sorry about that.
Okay. And you both know that you mean a great deal to us, both of you. And that's the beauty of this job is, and I don't even think of it as a job necessarily. It's what I do. And that beauty is that I get to meet people like you and forge friendships, and I'm just so proud of both of you. And, you have a lot of wisdom that a lot of people don't have. And so I appreciate you being here. So any last words to our audience, any wisdom you'd like to impart to them before we shut off these machines? Sarah?
First of all, I want to say thank you for everything you do. I tell people, anytime a mom reaches out to me to say, my child might potentially have this, I send them to y'all's website first and foremost. So just having that resource is amazing. Having the ability to share information, I alluded to that earlier, and be able to have a place where there's a depository of information, again, amazing. And so thank you for everything you do and the advocacy you do with the partners and all of just gathering the information and putting it in a place and having the understanding. So thank you, really. I can't tell you how valuable that is and how much I appreciate it. So I think that's my very first piece. And my second piece is I just appreciate the people that are in the community that we do support each other and that we are part of a bigger collective. Denise is in a different situation than I am, but she was kind enough to sit down with me one day and just share her story and her information and the pieces that she learned. So even though we're on different ends of the spectrum, there's still information that I could glean from her and still will glean from her, I'm sure. So I just appreciate that this is here and this opportunity. So thank you.
Great point. Thank you, Sarah. You know how much we love you. And the thing is, she's absolutely right. You're not alone. We try to tell people that all the time. You are not alone unless you choose to stay in that place. You've got a bunch of people with a wealth of information that you can access. And so Denise, any parting words from you?
Definitely echo what Sarah and you have both said. It is a group, it is a community and a network that we create that helps strengthen and support us in each of our journeys. And each of our journeys are different, as Sarah had said, but there is continuity, there is a thread all the way through somewhere along the line. I think it's very important to give back and to help educate and to help people understand those in front of us or behind us rather that are about to embark on this. Somewhere down the line, you may not go through it, but boy, if you get the opportunity to hear about more information, webinars, workshops, go to them. I encourage you to go to them. If you have a MPN a support group in your area, reach out to them, go to them and see what's going on, see what other stories are. You gain, our minds are kind of funky and we have to have something to measure against, and that in that process we get some comfort in it. And it's not to wait, oh, this is better or he's better or she's worse or whatever. That's not what it's about. It's that sense of, okay, they experienced this or they experienced something like this. And it's that comfort of, I'm not alone, as y'all have said. And then that can bust that bubble, and then you can then get a different perspective and say, okay, take a breath. Now what can I do? Okay, let's reach out to this. And the more people that you speak with, the more ideas that come about, the more the benefits everybody in this community and in this journey, whether it's now or 20 years from now or whatever, we continue to grow and build. And I think everybody's participation in it helps everybody survive and feel stronger. So thank you guys for putting this on and making it happen. Your participation, Sarah, it's great to see you again.
It's good to see you.
And, let's just keep making it happen. And certainly if there's anybody has any questions, through Anne, through the organization, I'm always available to help those who need any insight, or if I don't have information, I'm happy to, either kick it back to Anne or Sarah or whatever needs to happen and pass it on. Again, it's just support and to help everybody feel that they can make it through the journey.
Yep.
Thank you both so very, very much. And if you take anything away from this, just know you're not alone, as they both said, and we all said, and know that there are resources available. If we don't have them or individuals don't have them, we can help find them for you. And so again, thank you very, very much, ladies. I really appreciate it. Give my best to your child and family and to Andrea. And we will see you again next time.
That's great.
I hope.
Thank you.
Thank you all.
Thanks, folks. Okay.
Bye-bye.
Bye.